New COVID-19 cases have hit a new all-time high since the start of the pandemic. As we mentioned today, Florida surpassed 4 million COVID cases, breaking its single-day increase. The White House COVID task force is standing by its recommendations to lower isolation time for those who test positive, even as this new milestone was hit. News 4 Jax's Lauren Verno listened in on the meeting, and Lauren joins us now. So, Lauren, what came out of it?
Yeah, a lot of discussion today as usual. So this was actually the first time, though, we've heard from CDC Director Dr. Rochelle Walensky and Dr. Fauci since the new recommendations to lower isolation time from that 10 to 5 days was recommended. And that's, of course, if people are not experiencing symptoms after those 5 days. Here's what Dr. Walensky said led to the decision.
This updated guidance will help to ensure that hospitals, clinics, and long-term care facilities can safely stay open and remain appropriately staffed, both to handle hospitalizations from COVID-19 and to make sure that we continue to provide the necessary care for those experiencing heart attacks, strokes, and other illnesses.
Now, even though Omicron is by far the most contagious variant, Dr. Walensky said people are most contagious generally in the 1 to 2 days prior to the onset of symptoms and the 2 to 3 days after your symptoms start. And then after 5 days, if someone has no symptoms, then wearing a mask should lower the risk of that transmission. So that's a lot of that thought process there. Now, something you may have noticed missing from this new guidance, a requirement for a negative COVID test in order to return back to work. Here's what Dr. Walensky said was the reasoning for that.
We do know that certainly a PCR, you can stay positive in your PCR for a long period of time. But with regard to the question of your antigen, is we do not know how well those antigen tests perform at day 5 in detecting transmissibility. And it is for that reason that we would say, even if you had a negative test, we would want you to mask. And even if you had a positive test, we would also want you to mask. And therefore, given that these antigen tests are not authorized for use in this way, we did not recommend them at that time.
Now, PCR tests, the ones that take about 1 to 2 days to get results, now they're considered the gold standard for testing. And it's possible that these tests can still detect the virus a month after a person gets sick. So Dr. Walensky says that's why they opted to not add that to the guidelines and instead add the 5-day masking period. Which leads to the question, though, how reliable are these at-home tests, especially since the FDA came out yesterday saying they may be less sensitive at picking up the Omicron variant. Coming up tonight at 5:30, I explain why the task force still recommends those tests under certain circumstances. Tark?